All right, we are live. We will begin momentarily. Thanks for joining, everyone. Thank you.
Thank you.
All right, everyone. Good morning. Good morning, and welcome to Herald Inside LI Richner Live events. I'm your host, Sky. Today's virtual event is about health and wealth. Herald community newspapers and Richner Live events have taken the concerns of the community into consideration when putting together today's panel of experts to talk to us about their individual disciplines, and they have information to share with you. If you've been tuning into our Herald Inside LI webinar series over the last months, we launched in August. You'll know we do weekly webinars covering a variety of topics, and this health and wealth category is very popular. In fact, we did a health and wealth panel in October and one on estate and Medicaid planning in February. As the host, I like to keep these panel discussions conversational and engaging so they're not a lecture. We wouldn't want anyone being bored during this Zoom call since so many of us have so many Zoom calls. So this webinar is recorded. It will live on our website, which is liherald.com/insideli. So if anyone misses the webinar today, they can watch it there. And if you love what you see today, you can rewatch it as many times as you want. In fact, you can binge watch all of our episodes like you would a Netflix show. All of the Inside LI episodes are even on demand on our YouTube channel, so you can subscribe there. You go to YouTube and you type in Herald Inside LI and click subscribe. And again, all these links are on our website, liherald.com. So another way that Herald Community Newspapers communicates and distills the message of our panelists is through a recap article, webinar's discussion. And the news article is accompanied by a photograph. So I will take that photograph right now. Ready, everyone? Smile, panelists. Great. So that's the photograph that will accompany the article that recaps this discussion. It'll be in print and online, so stay tuned for that. And before we get into the conversation, I want to thank our sponsors, DōTerra, Emerge Nursing and Rehabilitation at Glen Cove Center for Nursing and Rehabilitation, United Healthcare, and Vishnick, McGovern, Milizio, LLP, and to the organizations that have contributed prizes to give away to today's audience. Our audience, you have to be tuning in live in order to win a prize today. So we will announce the different winners throughout our time together. We have 90 minutes allotted for this virtual event, and we'll be taking Q&A as we go along. So audience, you can use the Q&A function at the bottom of the screen to type in any questions that you may have for our panelists as we have today's conversation. So if you're healthy, you're wealthy. Especially during the course of this past year, was it truly reinforced that health is everything. And our panelists today include Johnny Espinal, Regional Sales Manager for Long Island and Queens with United Healthcare. Constantina Papageorgiou, please tell me how to say your last name. I should have asked you before this.
Papageorgiou, that was good.
Okay, Constantina Papageorgiou. She's a partner at Vishnick, McGovern, Milizio, LLP, who specializes in elder law and trust and estates. Wendell Miller, Administrative Program Manager of Neurological Services with Emerge Nursing and Rehabilitation at Glen Cove. And Cheryl Paris, Independent Wellness Advocate with DōTerra, an essential oils company. And Ken Shah, Senior Coordinator for the Cardiopulmonary Program at Glen Cove Center for Nursing and Rehabilitation. So since all of our panelists have unique skills and talents, I'm going to ask each one of them to give a more thorough introduction of themselves so our audience can fully understand their expertise and come up with some good questions. So I'd like to begin with Ken Shah from the Cardiopulmonary Program at Glen Cove Center for Nursing and Rehabilitation, who in addition to explaining his role, he's going to demonstrate 3 breathing exercises for all of us right now as we get started. So Ken, I'll turn it over.
Sure, Sky, thank you very much for having me, and good morning, everybody. My name is Ken Shah. I'm the Director of a Cardiopulmonary Program at Glen Cove Center for Nursing and Rehabilitation. Cardiopulmonary program, any patient that has a chronic or acute heart or lung condition, they qualify for our complementary cardiopulmonary rehab. It's an additional physical and occupational therapy that we provide to you to get you better at a quicker pace so we could get you home on a quicker pace. Purpose of the program is to help you breathe better, make you aware of your cardiopulmonary condition. A lot of us, as we get older, we don't know what our blood pressure numbers are. We just assume that it's 120/80, that's great. But the purpose of the program is to educate you about your condition and make you aware what's normal, what's abnormal. And part of the program is to help you breathe better. We have designed a couple of exercises. I like to go over 3 of the most important that I love the most, breathing exercises that affects my cardiopulmonary patient and helps them significantly. One of the exercises that I like to do is called pursed lip breathing. Second one is called 4-7-8 breathing. And the third one is diaphragmatic breathing. I'm gonna demonstrate it to you guys, how to do the pursed lip breathing. You wanna breathe in through your nose on a count of 4. And then you pucker your lips and breathe out on a count of 6 to 8. You can say how many times you have to do that. It's up to your comfortable level. You could do it while watching TV or when you feel anxious, shortness of breath. That's one of the pursed lip breathing. The second exercise I like to call, it's called 4-7-8. It's relaxing breath. So you want to do that in the sense you're sitting in a comfortable position. You want to breathe in for 4 seconds. You want to hold that breath in for 7 seconds. And then you want to breathe out for 8 seconds. We're going to do it again one more time. I'm going to breathe in for 4 seconds. That's relaxing breath. This exercise helps decrease fatigue, reduces anxiety, reduces, if you're having difficulty falling asleep at night, you try that by the 5th or 6th one, I'm pretty sure that you'll start feeling a little sleepy. It'll help you sleep better throughout the night too. The third exercise that I like to do is called diaphragmatic breathing. Diaphragmatic breathing, as we get older, our posture changes. We tend to have a kyphotic posture where we'll lean forward and we put pressure on our lungs and we don't take deep enough breath in. We start taking shallow breath in. So you want to sit in a comfortable chair, shoulders back, put one hand on your chest, second hand by the abdominal area. As we breathe in, feel the abdominal area rise. You're pushing the diaphragm down. And pucker your lips and breathe out. As you breathe out, feel the abdominal area going in and your chest coming out. That's a diaphragmatic breathing. How it helps with your breathing, improves with the anxiety if you feel shortness of breath. Very important while doing walking, climbing stairs, or carrying object. And also by putting our hands on our chest and abdominal area where you are applying some form of a pressure. So it also becomes an isometric exercise for your inner respiratory muscles. So those are the 3 breathing exercises that I like to tell my cardiopulmonary patients or any patient that has a cardiopulmonary condition or shortness of breath, and it has helped them significantly.
Thank you, Ken. And it's not only for those patients, it's like you said, for anyone that's having trouble sleeping or if you're having an anxiety attack, which so many people are having these days.
Yes, definitely.
So, thank you, Ken. Now let's segue over to your colleague, Wendell Miller, who is with the program for neurological services at Emerge Nursing and Rehab at Glen Cove. So tell us a little bit about your program and what you offer.
Thank you, Scott. Thank you, Ken. I think that was a really good demonstration about breathing exercise because, sometimes we tend to not think about it's important to breathe and relax our accessory muscles. So that was good. So my name is Wendell Miller. I am the administrative manager for the neurological rehab at Emerge in Glen Cove. And part of my neurological program is that we offer a skilled nursing facility in a subacute sense, whereas we offer a lot of therapy, meaning that each one of our residents gets physical therapy, occupational therapy, speech therapy. We have physiatry involved. We have neuropsychology involved. It's a whole interdisciplinary team to support your patients who have a neurological order. And a neurological disorder could be anything from a CVE, a traumatic brain injury, encephalopathy, anoxia, all these things you hear about and you're like, oh my God, what is happening? But the key thing to remember in all of that is how do we identify someone as having a stroke? And so part of this lecture today and educating everyone is to get to know the acronym FAST. So the acronym FAST means face, arm, speech, and time. So when you see someone is having a stroke, these are the things you need to look for. The face, is the face drooping on one side? Are they able to raise their arm up? And if their one arm is down, that can consider that they might be having a stroke. Is the speech having a speech problem? They may be able to say, you may say, hi, sky, order, November, not making sense. And then time is important to time because it's a medical emergency. And that's so important that people know this acronym FAST, because then you can help support someone and get them help before the stroke is really a bad stroke. So part of my program is educating staff and family about what stroke is. I'm a physical therapist assistant by trade. I'm also a social worker by trade. So I come with over 14, 15 years of experience working in the traumatic brain injury world. And I have a lot to offer for this panel and for people who want to come to Emerge Neuro Rehab and see what our program is all about. Thank you.
Great. Sorry about that. I silenced my phone and somehow it communicates with my laptop and then my laptop rings. So
That's okay.
But thank you, Wendell. And again, audience, if you have any questions to any of these panelists, please use the Q&A function at the bottom of the screen and we can really dive more into their different disciplines. And I'd like to go over to Johnny now, who's live from Vegas. So thanks for joining. I know it's super early in the morning there. Thank you for being a part of this. And maybe you can talk to us a little bit about United Healthcare and maybe even the way that you would pay for maybe some of these programs like Ken and Wendell mentioned.
Yeah, so good morning. My name is Johnny Espin. I'm the regional sales manager for the Medicare department for Long Island and Queens, primarily Long Island. Most of my team, I would say 80% of my team work out of Nassau and Suffolk. United Healthcare is new to the Suffolk area as of last year, 2019. Actually, I'm sorry, 2019 was the first year that we sought out to go out there. We were selling for 2020 effective. So we officially have a little bit over a year there now. With that being said, wait, did I get cut off? I'm sorry, somebody was calling me. So yes, we have, I wanted to talk to that as well. For those that know that department and what we do, 4 out of the 4, I think 5 plans that are being offered in Long Island right now that help people with Medicare, I think only 2 of them are out in the field. And the other one is sporadically out there. United Healthcare has been out there, I would say right after they lifted the sanction where we can go back to work. We've been out there a little bit over 5 months now. So we're out there continuing to help the community. I have the luxury of managing a team of about 11 agents that work the Long Island area. They help with not only Medicare, they've helped people with even obtaining things further than just flat out Medicare products. I'll give an example. When we came to Long Island, there was a big need for understanding what a pool trust was. And that is those people that fall in that gray area where they make too much money to have Medicaid, but yet they can't afford to live, because they have bills, they have the cost to the amount of money they get in versus what they pay out is just not right. And because of the way the system is set up, it's really not fair to those that fall in that criteria. So our agents are trained to refer those people to organizations that do pool trust. And what that does is if you qualify, they take the bills out of your pay, and essentially what's left over is a Medicaid eligible limit. And now that person goes from making a $40 copay and paying hundreds of dollars for medication to having a zero copay potentially and paying 0 to nothing in medication. I think the most they can pay is like $6 for a tier 3 or tier 4 drug. So with that being said, we can talk about this all day, but I'm open to answering any questions, of course. There's a bunch of things that we do out here in the community. We just opened a new office in Brentwood. It's on right in the corner of Suffolk and 5th Avenue. We also have an office that has been there for years in Hempstead. But we are seeing a huge turn in terms of traffic. People know that we're there in Brentwood, and it's a location where the need is high. With respect to your question about how we pay, we depending on what plan they fall under, they would have that coverage. Some have higher limitations than others, or less limitations than others, but for the most part, we do pay for that kind of specialty care, because through continuum of care and preventive medicine is how the plan itself saves money. We catch issues earlier. And then the last thing I would say is that a lot of people don't know, but we incorporated early on during COVID the teledoc, the giving the members the ability to see doctors over the phone when they weren't able to go outside. And you would think, I mean, there was a lot of pushback in the beginning because they thought, okay, these people are seniors. For the most part, they don't have emails, they don't have computers. But you would be surprised. I would say that a good amount of the people, I think about 90% of the enrollments that we did during COVID was done over a phone and using DocuSign. So it's a new age. You know, these people are getting smarter, more digitally inclined. And I'm very excited to be a part of that, because should something, God forbid, happen again, I think we'll be well prepared to service the community.
Thank you, Johnny. And you know what? That ties into Constantina. So I'm going to go over to her from a trust and estates planning ahead perspective. You mentioned payment. So I know, because my husband's a trust and estates lawyer, about how the executive order changed that you can do a lot of these things from home and the telemedicine.
Right.
Let's go over to Constantina to talk about your discipline and an overview.
Everybody, thank you so much for having me. I am a trust and estates attorney, and I am also an elder law attorney, which they kind of mesh together, right? So trust and estates is the big umbrella, and it comes in different parts. So we have estate planning, we have estate administration, and there's this little niche of elder law that not all trust and estates attorneys do, but I happen to practice in the elder law field. And it actually does coincide a lot with what Johnny was just talking about. A huge part of my practice is working with all types of families, young families, older families, children of clients, clients that are found in situations where they may need long-term care. So planning to me is the most important part of trust and estates. I think that it's at the base, and I try to motivate people to get their estate planning documents prepared so that in the event they had some sort of traumatic injury or an accident or something, they'd have their documents in place. And really that's again, for everybody over the age of 18, really. In planning, a lot of people have the misconception that it's just a will, but a will is really just one of the 4 documents that people need. The most important document to me is called a power of attorney. Power of attorney is the one document that I don't want people leaving without from my office. It essentially nominates who's going to be helping you in the event that you do need the help, the assistance. You can't get to the bank. You can't call the insurance carrier. You can't access your records because whether you're in some sort of condition where you can't speak or communicate, or maybe you're homebound, maybe something else is going on that you're not able to attend to your daily affairs. And so that power of attorney is very important for people to have. It can absolutely be misused if it ends up in the wrong hands, but that's why it's also very important that you prepare your paperwork ahead of time and you put the people that you fully trust to stand in that position. Unfortunately, a lot of people get taken advantage of when they may be at a time where they're vulnerable, they may be sick, or the people that come around them are not the ones who would have normally been around them when they were healthy. So, planning ahead of time ensures that you're putting the people who you trust to facilitate and take care of your affairs in the event that you couldn't do it yourself. So along with the power of attorney, we always recommend a healthcare proxy, which says who's going to make your medical decisions in the event you couldn't advocate for yourself. A living will, that's the 3rd document, that states that actually states what your end of life decisions are. And so your healthcare proxy would essentially be guided by that living will document that may say that in the event that you were in an incurable or irreversible medical condition with no reasonable expectation that you would recover, you're telling your healthcare agent you can withhold or withdraw artificial means, hydration and nutrition. So that would help guide them instead of just springing it on them that they should make the decision, without any guidance from you. So those three documents, power of attorney, healthcare proxy, living will, are so important to have because they help your loved ones facilitate your affairs, make your medical decisions, and ensure that you are still the one in control, despite the fact that you may not physically be able to be in control, right? You've put these people in place and you've decided who's going to be making these decisions for you in the situation where something may happen and you can no longer make those decisions. And then when you pass away, the only document that comes into play is your will, your last will and testament. And the will directs who inherits your assets, who facilitates the distribution of your assets to pay your bills and your debts, to ensure that your wishes are followed. For young families who I tend to do a lot of planning with, young families such as my own, where we have young children under the age of 18, there's also a fifth document that I recommend that people have, and it's called a standby guardian form. And it's actually the form that states that in the event that both parents were not able to be the guardians for some reason, whether they were mentally incapable or physically incapable or missing or deceased, these are the individuals who would step in to take care of the kids. Now, obviously, this is like a 5-minute crash course, right? There's just so much. I can talk for days and days about estate planning, but just to touch a little bit on what Johnny was referring to, a huge part of my practice is Medicaid planning, and that tends to be for the older seniors and people who may have health conditions that we believe they may require long-term care in the future. And long-term care is essentially needing either assistance in a nursing home or needing assistance at home with your activities of daily living. And long-term care can be very expensive. For those who don't know, nursing homes and I guess, the Glen Cove team can tell us what it costs to privately pay on a day-to-day in the facility, but I've seen prices start at $450 a day and go up to $900 a day, depending on the needs of the patient. And so it can get very costly, and a home health aide at home can be the same thing, or it's usually less, but depending on what the individual's needs are, I would say starts at about $200 a day and it goes up to $400 a day to have a home health aide at home. So a lot of times what we tend to do is we try to engage in planning that will protect clients' assets in the event that they do require long-term care in the future. And so long-term care would then allow Medicaid to kick in, right? If somebody has engaged in planning to protect their assets at some point in the future, once they pass the relevant look backs, whether it be nursing home, which is currently a 5-year look back, or home care, which is currently in flux, community Medicaid, actually, which is a really big deal now in our practice. There was no look back for community Medicaid. And last year in the New York State budget, they passed a bill that will now make a 2.5-year look back or 30-month look back. They were supposed to start the look back October. They pushed it back to January. They were supposed to start it now on April 1st. But due to the public federal health emergency and COVID, they are not allowed. New York State is not allowed to implement this yet. So we're really in flux now. We don't really know when they're going to implement this 2.5-year look back. But we are anticipating it very soon. So people are rushing to put in applications for Medicaid now. If they require long-term care, they're going to need it very, very soon so that they can get in before that 2.5-year look back. So there's a lot going on in this field and in this part of the field right now. And I'm happy to answer any questions that come up.
All right. Awesome. Thank you, Constantina. And again, audience, any questions, type them in. I see a few have come in, but I want to go to our last panelist here, Cheryl Paris, to talk about holistic wellness and essential oil. She's with DōTerra. So give us an overview about that, and then we'll really get into some of the more details from each of you.
Hi, everyone. Thank you so much for having me here today. And So a little bit of my background, I have been involved in fitness and health for the past 25 years. I was more in the convention sector where I would host these huge conventions and trade shows, working sponsorships and trade shows, and worked with various companies along those lines. And my first experience with essential oils was I was at one of my trade shows, and there was a DōTerra rep, and I was suffering from a sinus infection that would not go away for 6 months. I was on nasal sprays. I was seeing specialists and doctors. And this bottle, this little bottle of Breathe, saved me. It's one of the DōTerra blends, saved me from sinus surgery. So the doctors were like, this is the next step. You've been suffering for 6 months. And so I went over to the DōTerra rep. She called me over. She saw that I was suffering, put a couple drops in my palms, rubbed them together, and it was really worked instantaneously. So I always had the essential oil, this bottle on hand over the years. And then one of my very dear friends who was actually a doctor and started using the essential oils on her patients. She's a podiatrist, so she used the oils with all kinds of skin and foot issues and was healing her patients naturally and they were avoiding surgery. So at the onset of the pandemic, I called her up and I said, I need to get, essential oils in my home. I need immunity. I need detoxing. I need to sleep. I have anxiety. And as you can see, I have an arsenal going over here of all the oils and products. It's not just oils, but they have products as well. And so I literally did a whole pandemic pivot professionally as well, because I was using the oils in my home with my family, then with my friends, and then with other people, and they were just seeing incredible results. So I was like, you know what? I love this. I really believe in it, and it's working, and I feel great, and my family was feeling great and all of that. And so I was like, I am going to switch over and become a wellness advocate for this company. I am a true believer in, what it can do. And it's not just about the aromatherapy, but there's a lot of different ways to use oils, and I'm happy to share that with you. But you can use it in cooking, you can use it with your pets and your children, and all the way, to seniors and golden years. I use it with my parents, and they're in their 80s. So I'm just really happy to be here and share these beautiful gifts with you.
Yes, and speaking of Cheryl's beautiful gifts from DōTerra, 5 lucky winners right now are going to win some of those oils to take home with them. And those 5 people have been randomly selected from our attendee list, and they include Pat Dowman, Ann Santillo, Jeff Butchick, Michael Lee, and Suzanne Bologna. So congratulations to the 5 of you, and I'm sorry if I mispronounced your name. But you will be getting the DōTerra oils. So those are our panelists, everyone. And again, audience, if you have any questions, put them in the Q&A function, and we'll dive into conversation with these experts here. And we'll email all those winners who we just named. So let's dive into some of the questions that came up as our panelists were talking. And again, I know a lot of you, your disciplines overlap. So even if you have questions or comments on what one another said, I'd love to just have that conversation happen organically, because sometimes as people are listening, they like to hear what you're saying, and then they'll have follow-up questions on that. So one of the first questions that came in from Lisa, she asked, what makes the neuro program at Emerge different from any other neuro program in a skilled nursing facility?
So what makes us different than any skilled nursing? We have certified brain injury specialists. So all my staff who are working with brain injury patients are all certified under the American Academy of Brain Injury. So they have a special skills, and additional to what we are training they learn as PT, OT, speech, they have additional training to help support these brain injury patients and their families. We also do a lot of family education, because the key thing in any recovery is bringing the family together. So we have the family support, we have the Brain Injury Association that we're part of. We also have an interdisciplinary team that works well with the rest of the staff. So each site that I oversee has a neuro coordinator. That neuro coordinator is coordinating all the services to help that support that individual from day one coming into the building to when they're ready for discharge planning. So that's what makes us so unique and different. We have the coordinators. A lot of the neuro programs, and especially in Long Island and also in New York State, they don't have a coordinator on site to oversee the whole building. So that's what makes us part of what makes us unique, and having the certified brain injury specialist and having a team approach to support the patients and family.
Thank you. And I know Constantina mentioned the different expenses involved in these programs. So for anyone wondering about that, I'd like to talk a little bit about those expenses if Constantina or Wendell, Ken, Johnny, if any of you want to weigh in on that cost.
And that, that's a good question, because each panel has something to bring to the table, which is fantastic. So with Constantina, it's so important because I see a lot of family members struggle with, okay, I have this certain amount of money, but I don't have enough money. I want to get Medicare, I want to get Medicaid. I'm torn between, is it community Medicaid I should get, or, because of the traumatic brain injury, I may need to get a TBI waiver. I know it costs, $432 roughly to stay in a nursing facility. And that is just for the regular care that they need. That's just medical care. We're not talking about the rehab part. So I hear a lot of these families struggle with that, and it'd be nice to have someone like Constantina really get in depth on how could families navigate in either getting Medicare, Medicaid especially, or community Medicaid.
Yeah, so really it will boil down to what does your economic situation look like, right? And did you engage in planning ahead of time? There are two different types of Medicaid, like I touched on very briefly. One is community Medicaid and one is nursing home Medicaid, or institutional Medicaid is what it's really called. And so if a family calls me up and says, Constantina, my parent had a stroke, and we don't think we can bring them home, they have to stay at the facility. I mean, Medicare, traditional Medicare will give you 100 days. So it's 100 days of rehab. So a stroke victim would go into, or stroke patient would go into a rehab center from the hospital, and they would start their rehab services. The first 20 days are paid for in full by Medicare. Day 21 to day 100, there's a copay of about $180 a day. And so if somebody has a supplemental insurance policy like United Health, like Empire, like Blue Cross Blue Shield, whatever the supplemental insurance is, depending on how much really they pay in their premiums and how sophisticated the system, the program is, their $180 a day may be covered. Now, this whole 100 days of Medicare is a very rough estimate. Medicare entitles you to that 100 days, but that doesn't necessarily mean that you're going to have all 100 days of rehab. There is a time where you get analyzed, and really you get reviewed by the facility, and they determine whether or not you still require the rehab services. Are you every day getting better, and is the care actually helping you improve, or are you plateauing and staying the same? You took 10 steps today, you're taking 10 steps tomorrow, and you've stayed consistent. At that point, the insurance will cut off, regardless of whether you used your entire 100 days or not. Now, whether or not you'll be eligible for Medicaid depends on what your asset situation is then. This gets very in-depth, but just as a very brief overview, when you have two spouses, as long as you have your power of attorney in place, and an appropriate power of attorney, which allows for gifting, which allows for transfers of assets, which a lot of people don't always have, then I can do emergency planning. If I have two spouses, I can move assets from one spouse to another spouse and get the spouse who's ill to qualify for Medicaid at a quicker and simpler situation. There won't be a 5-year look back in that scenario between the spouses when I'm shifting assets. But if there's no second spouse that I can shift to, and I have to transfer assets to a trust or do other types of gifting, then there's a 5-year look back. So sometimes it's too late to do that kind of planning where I can protect everything. However, we do have some tricks in our bag where we can engage in emergency planning and protect approximately half of the assets that one individual has. Again, as long as that appropriate power of attorney is in place, which is why I always urge that document gets done. If that's the case, then, you know, the patient or the patient's loved one, their agent under the power of attorney, their family members really need to seek out the advice of attorneys, elder law attorneys specifically, who know the rules, who know the laws, who can navigate the system, and who would be able to provide with advice as to how to do the proper gifting and the shifting. You can't just start moving money around and then, you know, decide to then go to an attorney. You should seek the advice first, get the counsel first, and then engage in the planning that's needed.
Hey, Constantina, if I could add to that, that was a great explanation, by the way. With respect, there's another thing that I've seen a lot out here in Long Island, and I was an agent before becoming a manager for Medicare. I was an agent in Medicare selling in Brooklyn. But when I got out here, I noticed that there's I don't know if it's the Medicaid department or the Department of Social Services in Long Island, but a lot of people that have a spend down, and a spend down, for those who don't know what it is like, if, let's say Medicaid says the limit is $875 a month, and you essentially make $1,000, then your spend down is that you have to pay the excess amount of income, which would be in that case $125 a month. Now, what the Department of Social Services doesn't tell you in Long Island, at least in Suffolk, is that if the member doesn't pay it 6 months in advance, they essentially don't have full Medicaid. So if you run them up, even if it's an institutional Medicaid application, they would have a code 48, code 47 on what we use to, and what most doctors use to access the income with access the insurance information, which is e-paces. That code clearly means, it'll say no inpatient hospital care. And that's just a mistake on the members. It's not even the members' fault. And in some cases, the members can't even afford to pay 6 months out. So that's where we fall back into the same situation when we talk about a pool trust, or maybe consulting a lawyer that has your experience to give them even more options past that. But what I will say is that that's a lot of that going on. And if you ever see someone that you know they should have Medicaid and they are on a spend down and they're like, well, I'm paying my spend down month to month, I don't understand why I can't have a dual plan then, and I have copays, and that'll speak to that. And that's easily resolved. So I just wanted to bring that up for those that don't know that it's happening. You know, I every day train my guys to look out for that and to read e-pace as well, so that if they run into those situations, then we could troubleshoot that.
There are some questions that have come in about Medicare and Medicaid. I'm going to ask this question from Maria. She asked, how can I start with the process of applying with Medicaid planning? I don't know if that's a Johnny question or a Constantina question.
I think that's both. Constantina, you're more than welcome to take it if you like.
Sure, I'll jump in and then feel free to cut in as well, yeah. Johnny. So Medicaid planning is, or how I have with my clients is I send out a questionnaire that they'd complete because I'd want to know what assets exist, what legal documents exist, right? Because Medicaid planning is not just, you know, transferring assets. It also includes making sure that the power of attorney is done, the healthcare proxy. So your base 4 documents should always be done. And then sometimes we build on it, like I mentioned before. Medicaid planning, a lot of times, as long as you're doing it ahead of time, it could include a trust. And I know that there was one of those questions there. What is a trust compared to a will? A trust, I always associate it with a box, and everybody who's heard me speak before will always hear about this box, right? You put your things in this box, you close it, you lock it up, and you give away the key, right? Once these assets have now gone into this box, they're out of your name. They're no longer in your control. So people who engage in this kind of planning have to be comfortable with doing that, right? A lot of people say, no, I want my money. I want my house. I don't, if I sell my house, I want to have the cash from it and whatever. There's so many different ways of looking at it. But essentially, it's important to know that not everybody wants to do Medicaid planning. There are some families that decide, you know what, I want to spend my money. And if, I get sick, I'm going to reverse mortgage the house and use the equity to pay for the best care at the nicest assisted living, at the nicest nursing home. And that's a very personal preference. But to start the process, you would, at least with me, start with filling out a questionnaire, answering some questions, giving detailed information regarding finances. I can't even stress how important that is. I've had consults where people haven't really wanted to tell me the entire picture. And that obviously creates an issue because I can't give the best advice if I don't have the entire picture. So you'd provide the attorney with the entire picture financially, and they would give advice as to, what maybe should be transferred into a trust, what should be held on to, depending on what the individual is comfortable with doing.
Okay, thank you. I hope that answers the question. And there are some more questions that have come in. I want to ask this question from an anonymous attendee about heart palpitations and breathing. So this is a Ken question, but also a Cheryl question, in my opinion, because this person asked, what kind of doctor can I go to help stop heart palpitations, even when a person's heart is in good shape and cardiologists can't determine what's causing the heart palpitations? So I want to turn to Ken and Cheryl. Yeah, Cheryl, go ahead.
Okay, well, so I didn't mention this before, but I can speak, I'm very knowledgeable because from a personal standpoint, which I'll share with you and all of Long Island now that it's out there. So I was born it was found at 11 years old that I have a mitral valve prolapse. So for most of my life, I'm not afraid to say it, but I am 50 plus out of this group here. And for most of my life, I suffered with heart palpitations. And my symptoms got worse over the time in my 40s. And 3 years ago, almost to the day, last month, I did have to have open heart surgery to fix my mitral valve repair. And I will tell you that essential oils, I wish I knew about it years ago when I was having those heart palpitations, because there are so many ways to go with that as far as, no, it's not going to take it away, but heart palpitations are usually brought on by stress or anxiety or a lack of sleep. For me, it was a mechanical issue that a lot of people suffer from. They have a heart murmur or a valve issue. And, but if I had the essential oils, I would have been able to calm myself down rather than go on maybe some prescription drugs that I've had to do. So there are ways to at least calm you down. And the other nice thing about it is that one of the spots I actually put even something like Peace. Peace is a very calming oil. I will take that and I will rub that right over my chest and my heart. And not only do I get the benefits aromatically, but topically as well. So there are like lavender and adaptive is another one that really reduces stress and you can just diffuse. And I'm sure that along with Ken's breathing techniques, you should really get some relief from that. So I'm here if you have any further questions on that or on my open heart surgery or any of that. So
another test that you could do, the thing that can help you is electrophysiology. It's usually done at a cardiologist or your internal medicine physician that you attend to. It's usually they inject the electrical stimulation nerves into your veins and see what's taking place, and it can help significantly. But again, as I said, I'm not a medical doctor, so you would have to consult your cardiologist or internal medicine doctor to see if you would qualify for that with the condition that you need.
And I'd like to add to that also, because obviously having had the surgery, for years I was monitored, and with a simple echocardiogram, it's non-invasive, it's very simple, doesn't hurt. You can get a lot of information, and my cardiologist, that was the marker that we went along with. And, hopefully just something simple with that. And of course, I'm not a doctor either. So, definitely check, but that's definitely a way to go for being tested.
Yep. And also what Cheryl said, breathing exercises. One of the things that stands out the most is a mindful meditation, and incorporating breathing exercises with it. It calms yourself down. You have a better control over your heartbeat and your breathing, because remember, heart and lungs, they both work hand to hand. One cannot work by itself. Every time your heart pumps, it circulates the blood throughout your body. You're taking the breath in, you're breathing out. So mindful meditation, it could be varied from 8 minutes to 11 minutes. And it makes a significant difference. With my cardiopulmonary patients, I used to do it once a week. And a lot of my patients here, they would come in, they're anxious, anxiety, they're depressed, and they wanna go home and they wanna get better at a quicker pace. By doing that 8 minutes of meditation, it was making a significant change in their active daily living while they were at a subacute facility rehabbing.
Ken, are there any certifications necessary for cardiopulmonary rehab?
So right now, most of the cardiopulmonary rehab are outpatient. Paragon Management, which Glen Center falls under, we are working on our certification with American Association of Cardiovascular and Pulmonary Rehabilitation. And once we do have that, we will be the only subacute facility that will be certified with this certification, because right now they only offer it to the hospital. And in New York, we only have Suffolk Hospital out east. They're the only ones that are certified. They haven't affiliated with any subacute facilities. We have reached out to it, so we're working on that. But yes, we don't have any inpatient rehab that are cardiovascular or cardiopulmonary certified right now.
And when I spoke with you, Ken and Wendell, before this panel, I learned about your facilities are inpatient, but there are also some support groups for people who are not at your centers that can participate in some of your activities and classes. Would you like to tell us
Sure.
about those options?
Sure. So we do support groups. Right now we have 6 of our buildings that has a cardiopulmonary program. It's inpatient, and each building does support group once a month. And support groups are their patients that were at in our program at our subacute facilities, or peer members from the community, their neighbors. Like one of the support group I run, I get about 17 participate in there, and they're from Florida, California, and some of them were my patient and at Glen Center, and some of them they found out through the social media and word of mouth that, hey, the support groups are offered through this facility and they're completely free, and they're run through Zoom, and we do different activities. We do breathing exercises, any questions, concerns that they have regarding their cardiopulmonary conditions. And we also do one other thing that I do is some of my members that are on the Zoom, they were my patient before at a subacute facility at Glen Center. So I do harmonica classes, and using a harmonica classes or recorder, it helps them strengthen their inner respiratory muscles, because a lot of us, we go to physical therapy, occupational therapy, speech pathologists. Once we leave subacute rehab, we go to outpatient. We do balance training. But what about your inner respiratory muscles? How do you strengthen them? You can do the breathing exercises, which is a pursed lip breathing, diaphragmatic breathing, 4-7-8. Those are resistance-free exercises. By using a harmonica now, you're using a resistance on inhalation and exhalation, and that becomes an inner respiratory muscle strengthening exercise, and it helps patients significantly on breathing. How many minutes? Anywhere from 5 to 8 minutes. So the members that attend my class, they have it, some of them because they were my patients, and the ones that they don't have it, they usually purchase it from Amazon or a toy supply store, a kid's toy supply store.
See, so that's an advantage of working with people on Zoom, that you can have people from all over participate in your classes, and you engage with people that maybe you never would have before.
Mm-hmm. Yes.
Wendell, are there any programs that you wanted to talk about that you offer through your program that people can participate in?
So like Ken, we offer also a family support meeting where we have, we do it through Zoom every Thursday, last Thursday of the month at 6 to 7 p.m. And it's really for families to really network because, you know, a lot of times, you know, you're thinking, oh, I'm the only one in the situation. It's my mom who had a stroke, or my dad had a stroke, or my son who's a 21-year-old who I think will be living forever. And all of a sudden he have a traumatic brain injury and he can't do anything. And what do? You know, who do I speak to? I have no one to speak to. So what we do is that we bring these families together once a month and really have them talk about, hey, you're not the only one. I'm getting support from, you know, Wendell or someone in his team to help me, guide me, and navigate me through, you know, this whole traumatic brain injury world. You know, maybe they need a lawyer. We could maybe have Constantina come in, or we can have someone, we have guest speakers who come in and say, hey, this is my story. I want to share it with you. I want to share it with the world because I had a stroke 2 years ago. But now, look at me now. So it's really about getting the community together and supporting the family and navigating to a place where family can say, you know what, I'm really not alone. You know, I too have a story. And I just, like yesterday, an interesting story. One of my clients, my patient who 2 years ago when I was practicing clinician, she had a stroke, couldn't do absolutely nothing. She sent me this fabulous video saying, look at me. You know, it's on our Facebook page now. She's able to raise her hand. She's able to walk. When she came into us, she could do absolutely nothing. And to share that story with family and share it with the world, and to say that, you know what, you're getting the help. We at a neuro rehab has emerged in Glen Cove. We have the support. We have all the clinicians there who could help support you, and they're getting all the help they need.
Excellent. So people have asked how they can participate in your classes and in the Zoom. So I've received that information, and I want to tell everyone that we will put those numbers. And I know that not all people are tech savvy, so they're phone numbers that you can dial instead of having to go to the website. You can call this number, and we will put it in the description of the recording of this webinar on Zoom. It'll be in the description, the numbers to call to participate in those classes and workshops. So thank you.
You're welcome. One other thing, Cheryl, I would love to network with you as well, because right now, especially with coma patient and essential oils are so important because it elicits different things, brain activities. So I know, and we use a lot of lavenders and stuff like that to help, and we see a lot of response. Someone is triggering a response. Maybe he could smile, maybe he could raise his eyes. So I think essential oil, using a holistic approach is so important. So thank you for sharing that.
Thank you so much, Wendell. I totally agree, and I would love to. Always up for a collaboration, and it works with every age, and let's do it.
See, this is great. There's networking happening in real time on this webinar.
Sky, one more thing I like to add. All of our buildings, the cardiopulmonary programs that we have, the cardiopulmonary directors, we are associated and certified with the American Lung Association. So when we run those Better Breathers class, it's through the building, but we're also certified with the American Lung Association.
Perfect. That, and you put on the breathe oil that Cheryl mentioned. Woosah.
Yep.
Okay, I want to come back to some of these questions that have come in. And again, anyone with questions, type them into the chat. So question about maybe someone in some of these facilities that we've spoken about who loses their capacity to make decisions. That's where Constantina would come in. So maybe you can talk to us a little bit about what happens in that situation, or if there's a dispute with family, if there isn't a document in place and a family is disputing how to handle an older family member that may not be in their proper faculties to make a decision about their next steps.
That's where it gets complicated. And that's why that first document that I recommend is the power of attorney. So if you don't have a power of attorney in place and you don't have somebody who legally can represent the incapacitated person, your only option is to go through the courts and into a legal guardianship. It would be essentially under the mental hygiene law, Article 81, where you would go into court with paperwork to advise the court why this individual requires the assistance of a guardian. And you know, obviously you have to make it very clear they can't do, you know, their finances, they can't handle their medical decisions, these are their needs, and they can't understand the limitations of their limits, essentially. So you prepare paperwork, present it to the court. When there are many family members with many different opinions, it could turn into a contest. It could turn into a fight. And sometimes the court will go with a family member because that's the preference typically. But if there's nobody in the family who gets along, if they can't reach some sort of agreement, then it could turn into an independent guardian. They're called Part 36 appointees. I am one of those individuals who is on the Part 36 list. So I do receive appointments of guardianships. And essentially that individual will now become responsible for the care, the finances, and anything else that needs to be done on behalf of the incapacitated person. Now, just to add a little disclaimer in here, and I absolutely did not enjoy the I Care a Lot movie. I don't know if any of you guys had seen it.
I was thinking the same thing right now.
Let me tell you, it pertained to guardianship, and I think it painted guardians in a really bad light. And while there could be some guardians who are terrible people, I'm sure they're terrible people in everything that is in this world, right? A lot of guardians actually do really care. And I can say that we do whatever we can to help the person who is incapacitated. But we want to avoid that. We don't want people going to guardianship court. Guardianship court can get very expensive, especially when there's a fight, and it's time consuming. And everything you do, you go through the courts. It's not like that movie where she could have done whatever she wanted. To sell a house, you need permission. To spend a decent amount of money, you need permission. So it's not as easy as it looks. And it definitely is cumbersome on the family. That's why that power of attorney, again, I can't stress it enough. It's just so important to have it before you lose capacity, because once somebody is not really well enough to make decisions for themselves, say they're suffering from dementia, which is pretty accelerated, or you know, they can't answer basic questions about their finances, about where they're located, who their family members are, it's too late by that point. They can't sign a power of attorney. So the only way to go forward to take care of them at that point is the legal guardianship.
Now, someone asked, at what age should you appoint a power of attorney?
I'd say when you're 18, when you go away to college. I think it's even more important then too, right? Because let's say you have a college student who went to school. Legally, you're not entitled to anything pertaining to their records at that point. You're really not. As a parent, you can call the school and ask for their report card or their transcript, and they're going to tell you, sorry, we can't give it to you. You know, if your child ends up not being in a good scenario, you don't have the legal authority. Once they're 18, your child is emancipated. So I recommend estate planning starts at your 18th birthday. It doesn't usually start then. People tend to think that you have to be older or you need to have a lot more money to engage in that planning. I think that estate planning can be done just as you reach adulthood, if not shortly thereafter, but especially when you are, you know, on your own and you want to make sure that someone can step in to handle your finances, can get into your, you know, your bank accounts, especially when you have a family. You want to make sure you have a will in place, you have guardianship documents in place. All of this is very important to ensure that you're protected.
You know what's not fair, I just realized, is you're 18, you're on your own, and you're not until you're 26 that you're off of your parents' health insurance, right? So
unless you start working earlier and you come off their insurance, right? But even that, like if a parent calls to try to get details about something on the insurance, they're not entitled to it. I was on my husband's medical insurance when I delivered my second child, and I called to get details about, you know, the details of the policy to try to get information. They wouldn't give it to me without the power of attorney. So even though I wasn't insured, you know, it was my bill, and they said, sorry, we can't tell you about the out-of-pocket maximums or what you're going to be responsible for because it's your husband's insurance policy. So things like that, where, you know, you need authority to get some information, it's important to have that authority.
Constantina, I just we'll be talking after this because so much of what you're saying is pertinent to my life. I have my parents, thank God, and they are in their 80s, and I have two sisters. So we have touched on a lot of what you're sharing today. So that's going to be a side note. And also I can attest to exactly what you're saying because I do have two daughters that are in their early 20s, and you cannot get any information. So that's good for them. They're protected, but I've tried not, with their mom, can you do this for me?
Right.
Sure. Let me go get you your prescription, and you get questioned or take care of a bill because they are still under my insurance. So we have a lot to talk about.
Sounds good. I was also going to ask you, like, when you have a lot of stress, do you put a lot of those little humidifiers everywhere? Because that's what I'm thinking I was going to hit you up for. I was going to put one in this corner, one in that corner.
Oh,
one in that corner.
Don't worry. I will hook you up. But actually with essential oils, and the beauty of it is that less is more. So they're so powerful. So just for 1 or 2 drops, even in a diffuser, that will run 6 to 8 hours a day, you will get the benefits all throughout the day, and smells good, so the uplifting. But yes, we have a diffuser in every one of our rooms,
Right,
for various reasons.
Right.
So it's all what works for you. But yes, absolutely, we will talk, and I will completely hook you up.
Sounds good.
And speaking of that diffuser, another lucky winner will win one of those DōTerra diffusers. So we'll pick a name randomly shortly. As soon as Courtney sends me the random name, I will announce who that winner is. But back to this planning ahead and ages. Johnny, at what age should someone come see you or one of your agents when we start talking about health insurance?
Well, if they want health insurance and they're under the age of 65 and don't have a disability, then they would reach out to our Medicaid or our Central Plan department, and they're like Constantina said. Did I say it right, Constantina? They're emancipated after 18. They're on Child Health Plus, and it's different from if you work for a government, like let's say you're a city worker, you're right. So long as the kid goes to college, they'll stay on the insurance. But when they're on the Medicaid plan or an essential plan, once they turn 18, they're on their own. So I would agree. I say that they should, in addition to going after their own insurance, they should start planning for, I'm almost slapping my own wrist because I didn't do that. I didn't start planning myself with respect to what Constantine is talking about. So I was 36. So I started really late. But yeah, if I knew better, I think 18 is the perfect age for that. And to do your own insurance as well, because you have to at that point.
This is the stuff they should be teaching in school, in my opinion.
Correct. Yeah, I agree. Mm-hmm.
Not find the length of the third side of the triangle. I mean,
Johnny, I have a question for you.
Sure.
So my daughters are 23 and 25, and they are on our health insurance policy right now, but they do both work full time. So is it better that, so my older daughter, she's going to turn 26 this year. So obviously she's going to have to come off and, take the insurance that the company has. But what about my 23-year-old? Like for the next 3 years, should we keep her on ours, or should she?
That's a great question. And to be honest with you, it's answered on a case-by-case basis. And it's only because your insurance, just because you have an insurance through your employer, it may be different from the one I have, the one that Joe has, the one that Jose has, because depending on the amount of cost share that your company that you're employed under forfeits, that is what you have in terms of insurance. Whatever money they put in, you could have a higher copay, maybe your deductible's higher. So what I would suggest in that situation is really to sit with someone, if that's the case, and see what works out for them. Maybe going on an essential plan is going to have less coverage for dental, then maybe she doesn't need a lot of dental work. And maybe instead of you having to come out of pocket $178 every paycheck, it'll cost her $20 or $48 a month to have just as much insurance. And she basically, and she may not be using it anyway, you know? So again, it's a case-by-case, it'll be on a case-by-case basis. Now, if we're talking about people that are on disabilities or people over the age of 65, then that's a completely different scenario. You know what I mean? I hope I answered that question to your understanding. There's not a perfect answer for that question.
Right. No, but just to research it further, your point. Yeah, that's a great point.
And we have agents, we have departments that are readily available to help you. What I teach my guys is, you know, we do work for a carrier, work for United Healthcare. And obviously, we're always going to show the consumer the benefit of having our plan, you know? But in addition, I teach my guys that if you ever have a situation where maybe them going to a competitor is the best situation for that person at that time, then that's the right thing to do. And ultimately, in the future, if something changes, they're going to come back to you, because it's better to work that way than to use like to try to pressure someone or even try to sway them to get something that you yourself know that might not be best for them at that time. So I mean, I'm very confident, and I know that my guys do the right thing 100% of the time. You know what I mean? So if you ever have those questions or that scenario, I can put you to speak to somebody to get you so that you can have some kind of comparison.
Thank you.
You're welcome.
I have a question for you, Johnny. So I know some of our patients right now, when they have, they have Medicare, after their 20 days, as we said, it's full, they have full coverage for the first 20 days. After day 21, they may need a supplement. Would you be able to offer them or United Healthcare or offer a supplement insurance?
Yeah, we do that as well. We see that a lot when people get on med subs because of a certain situation they're in. And then after like a year or two, they'll go into a decent plan should they have, if they're dually eligible. If not, they'll probably go into a regional PPO, or some even stay on the med sub plan. But yeah, that again, another situation would be case by case, because you have to really sit down with the consumer and say, okay, you're going to come on a med sub, but you're going to lose out on these ancillary benefits. Like, for example, there are a couple benefits that we offer. For example, if they have Medicare and Medicaid, we offer them a gym membership through Optum Health. So some of these gyms are like $90 a month, and we pay for it through there. We also give them an OTC card where we give them $300 on a quarterly basis that carries over should they not use it for over-the-counter products, so they don't have to come out of pocket. Another topic here is health and wellness. Wealth and health, they come together. If you don't have money, you're not able to stay healthy, and you're not going to be healthy if you don't have the other, right? But ultimately, health to me is number one, because if you're healthy, you're the richest person in this room, right? But if you're not doing what you're supposed to be doing with respect to the preventive medicine and taking care of yourself early, then you're really, digging yourself into a grave, so to speak. So to answer your question, yeah, those, depending on the situation, we would probably recommend the med sub if we know they're going to overly utilize a benefit that's not offered to them under a decent plan or a regional PPO.
And the second part to that is, okay, so now they get a supplement insurance, you offer that. They say the average length of stay, they say 60 days. Correct. What happens if after that they're ready to go home and they want to drop your insurance? Could they drop it at any given time, or do they have to wait for a full year?
No, not for them.
These are some of the questions, family asks, family support meeting. They ask questions like that.
You see, that's another. It's a great question, because it depends where they fall in the quarter. They may have a available SEP. For example, the state just released an SEP just recently for, I think, to the end of March 31st. All those affected by the storm that we had, the big snowstorm. Because of that snowstorm, it opened up another SEP. So if someone in that situation can say, well, I couldn't go shopping or collect my medications or I couldn't call a Medicare agent to help me with the situation to guide me the right way. They can use that SCP, and that opens up another like another opportunity for them to make a change. So again, if I say yes, it's a yes for now. If I say no, but then it could be a yes 2 months from now, right? So it depends on the month you're in. It depends what's going on. The Medicare agent is always, understanding their environment and knowing the changes that's happening, and they're always going to offer the best opportunity for the person that's in that situation. You know what I mean? But right now, it would work. Like if you ask me, I have somebody right now and they have that situation, then I can tell you yes, because we still have time to use that SCP, for example. On the end of starting OEP or the start of AEP, of course, they can draw right back in there. But if you're in the second quarter, it may be a little tricky, but the answer is still not no. It could probably be done. If they apply for example, EPIC, which is something that helps them pay the medication, and they get denied, just them applying opens up another SCP. You know what I mean? So there are things that could be done to help the member attain the care they need, so long as the agent knows what they're doing and they're guided the right way. And it's done compliantly, because that's very important to our company. We have to make sure that everything we do is compliant. And, we're not living in this gray area where, although we're trying to help people, we still have to do what's accepted under the law.
See, this is panelists talk to each other, because at the end of the day, you guys are the experts. I'm just here to facilitate the conversation, but it's great to hear the experts talking to each other, because it really informs the audience. So again, audience, if you have any other questions, let us know. Constantina, was there something you were going to add?
Yes, I just wanted to jump into what Johnny was saying. You touched on this briefly, but what's really important to know is that a lot of these are so fact specific, right? So what Johnny was saying is like, it depends. And I know my clients hate hearing that answer sometimes, but sometimes that's the answer. A small change in circumstances, a different fact, the fact that they're receiving a certain type of care now, but they may not need it later. Could change, certain assets that you have, whether they're retirement, non-retirement, that could change an entire plan. And I think that, there are situations that come up where so many people think, oh, I could just go onto the internet, print out a form, and then here I have it. I don't need a lawyer, I'll just print out a power of attorney and be done with it. That's not necessarily the case, right? Because everybody's circumstances are different. So, going to a professional, speaking to Johnny and his team, speaking to Wendell and Ken and their team, and Cheryl and her team as well. There are different situations and different scenarios for everybody. And you need to seek out the right advice from the people who can help you, who will base on the advice on what you're telling them. Not just, a blanket book, like pulling out a page and saying, here, this is yours, this is yours. It's not how it works for anything, for medical care, for legal care, legal help. It all is very fact specific. It's important to seek out the assistance from people who can help.
So there are more DōTerra oils to give out, and I would like to announce the next 3 winners of these oils now that we know how they can complement our health and wealth. The DōTerra Petal Essential Collection is a diffuser and 2 oils, and that's going to Larry Kaiser. Congratulations. The DōTerra Family Essentials Kit, that's 10 essential oils. That's going to Cheryl Pearson. Congratulations. And the DōTerra Introductory Kit, that's 3 essential oils, and that's going to Eileen Schuss. So congratulations to those folks. And Cheryl, was there anything you want to add about those oils? And then I'll probably go around to each panelist and have everyone give some concluding thoughts as we look towards the end of today's session.
So congratulations to all the winners. You are getting these amazing gifts from the earth. And of course, what comes along with the oils is an education. So we do, our team here on Long Island, we have a continuing education class that's free to all of our customers every Monday night via Zoom. And it's just important. It's one thing to get the oils, but have them sitting on your shelf does no one any good. So, so we offer this continuing ed, but anyone that is part of this program today or tunes in and listens and wants a free consultation, I'm happy to do that. But also anyone that the oils has to have a consultation with me, because you really need to know how to use it, the best way to use it, and tailor it to your needs. So that is number one. And I guess since I'm on, I can just give some last minute thoughts, if that's okay. So DōTerra is a networking company. So there are opportunities with DōTerra to have another stream of income, or just, become a customer, but pay for your oils if you're sharing it. So there's that I always want to put out there, because it is a great business opportunity. And with so many people out of work now, this is something you could do from your home. We have a great team here on Long Island, but customers all over the world. And it's a $2 billion business with millions and millions of users. And I can't speak on other essential oils, but this is so pure, and everything this company stands for is just amazing with their farmers. And so that is one thing that I wanted to mention. The other thing that I wanted to mention is, and this goes for all the other amazing panelists here today, I would be happy to give any free workshops at any of your companies or businesses, and whether it's Zoom or if we feel more comfortable in person, because that's the whole thing with the touching and the, smelling and experiencing the oils. So I wanted to mention that. So anyone that wants to collaborate, I'm open to it. I love this business and this company, and especially collaborations. That's really my forte. So would love to hear from any of you. And I guess, Sky, you're going to share the information, like my email, my phone number. I'm happy to share any of that with anyone who wants to get in touch.
Great, fantastic. Yes, we will. We'll put all the any links, names, emails, suggestions that you heard today during today's webinar will be posted on the YouTube page. So again, you can binge watch all of our episodes and you can rewatch today's webinar and subscribe, and you'll get that information. So thank you, Cheryl. Constantina, let's go to you next.
Wanted to thank you for having me, also to thank all the panelists. I think we have a great group of people who are very knowledgeable in what it is that you do. So thank you for joining as well. And I just, I've said it already. I think I'll just give a very quick sum. I think that it's very important to put your planning in your own hands to ensure that you protect yourself, you protect your family, and that your wishes are followed. Now during your life, if you're not capable, when you're incapacitated, if that were to ever happen, and ultimately upon your death. So make sure you seek out legal counsel, somebody who does this line of work, so that they could be able to guide you appropriately. And if there's anything that I can help with, feel free to reach out. I'd be happy to help.
Okay, fantastic. Because I know a few very specific questions came in for you, Constantina, but I will refer people directly to you to answer any of those type of questions. So thank you. Johnny, you're next.
Thank you for having me, by the way, guys. It's very informative. One thing I wanted to bring up was the fact that United Healthcare, we have a strong view on what we call partners in care. And that model of care is pretty much self-explanatory. It's not only about insuring people, it's not only about talking to them about insurance, but also becoming that beacon in the community that pretty much puts together those community-based organizations and gets those services out to those people that are in need. So with that being said, I want to offer myself, my office as well. We already have a program that I'm working with my core community outreach representative. I think he might be on the call. His name is Joseph Bouquet. And we already have the people who do public assistance, food stamps, housing, different organizations coming in on specific days. I want to be able to fill the calendar. So once this COVID is, God willing, a little less crazy and more lax, that we're able to maybe offer the services that you guys here have through the offices as well, because I think it's important for people to know all of these resources that are out there that they may not be utilized. In addition to that, I will leave you with my last statement, and it's that together we have to really help, especially Long Island, Suffolk County. There's a huge stigma out there that if you have Medicaid, you're a public assistance, or you're on welfare, or you're cheating the government. You know, there's people out there that make $2,000-3,000 a month because they've retired, but their mortgage payments are $3,500. Their oil is $800. The point is that it doesn't matter that you make a little bit of money. If you can get on Medicaid, you should not be embarrassed, because you pay taxes throughout the years of your life. You know, you put in so much money to the state, and when you're in need, you should be able to use it. It's not only for those that are living in the inner city and live in the projects or live in our Section 8 housing. That's a stigma that we have to try to help people get over and start helping them help themselves.
Thank you, Johnny.
No problem.
Wendell.
Hello again, and thank you, Sky. And I think this panel was absolutely wonderful, and the audience, just to to explore and learn from each other, because we have a wealth of knowledge. Like each one of us comes with a lot of knowledge in our area. To close off, I would really want to invite everyone to join our family support meeting. It's on Thursdays at 6 p.m., the third Thursday of the month, and not only that. It's to learn from each other, again, because family, again, the support is so necessary. Part of Paragon, which is, is the umbrella of Emerge and Glen Cove, is that we offer so much knowledge and support and medical term for our patients and family, and that we could take patients who are having a brain injury or a stroke from the community. So if you have a stroke or a brain injury and you don't know or have a place to go, within 30 days of coming up from the hospitalization, we could have a PRI, which is a patient review instrument. We could take you into one of our facilities and you could get a rehab if you have Medicare or Medicaid, and we can help support you in our buildings, because we offer a vast knowledge of staff who are trained in brain injury to help support you. So thanks, everyone.
Thank you, Wendell. And last but not least, Ken, who kicked off our discussion with the breathing exercises.
I want to thank you all for having me, and a great panel. It was great information I learned, and it was really helpful. Sky, thank you for organizing this whole presentation. And I would like to end with the conversation. It is very important to be on top of our health. A lot of the times we get up in the morning and we're like, it will go away. No, if you go, a lot of us, when we go to Rite Aid, CVS, or Walgreens, we take our blood pressure and we get a reading of 140 over 90, or we get a reading of 160 over 100. And we're like, I want to be scared. I don't want to tell anybody. It will get better by itself. No, it won't get better by itself. There are many different factors that plays a role into it. So it is very, very important to be on top of your health. And if I like to tell my patients, my members, that if it is very important to touch base with your specialist every 3 months, a cardiologist, pulmonologist, if you have those chronic conditions, and be in touch with your primary care physician, that if anytime you wake up in the morning and you wake up with the not feeling yourself, you want to reach out to your specialist, to your primary care physician, to inform them that, hey, I woke up this morning and I noticed this changes in myself. With COVID going on, we're confined to our houses a lot. We're not associating in the community events or social gatherings. And so we might not be able to see the change in ourselves because we see ourselves every day in the mirror, but a friend that we associate with and we haven't seen them in 3-4 days and we come across them, they might be able to see that change in you and we might say, hey, what's going on? You're not looking yourself. So it is very, very important to be on top of our health. And as a cardiopulmonary program, as I mentioned, one of the unique things that I like and I want seniors and everybody to do is not physical therapy is there, but aquatic therapy. Summer's coming along. It plays a significant role. Geriatric patient population. You want to concentrate on Pilates rehab. Very, very important. Chair yoga incorporates breathing relaxation with the diffuser and the essential oils. It makes a significant difference in your health and well-being. So I want to thank you very, very much and be on top of your health. Thank you. And our Better Support Group classes, as Sky mentioned, that's a great source of getting more information and learning and educating yourself on it. So I would love to see you guys and see if I can help you on our Better Breathers Club. Thank you.
Awesome. Thank you so much to each one of our panelists. Thank you so much. Thank you to our sponsors. I will share my concluding slide that has all of our information on it, the logos of our sponsors. Thank you so much. We'll post everything on our YouTube channel, the contact information, and our website is liherald.com/insideli, where you can refer back to this webinar and watch it as many times as you want on YouTube. And thank you to our audience. Thank you for your questions. Thank you to our panel for your time today. And stay safe, stay healthy and wealthy, everyone. And we'll see you next time on Herald Inside LI by Richner Live.